Good morning, everybody.
Good morning.
I thought this was a good time to discuss our new patient, a 35-year-old right-handed woman who is admitted today to our unit, transferred from acute care of the hospital. She's status post stroke, probably induced by her history of uncontrolled hypertension and consumption of large amounts of caffeinated energy drinks. She is an attorney working on a very intense case, who is a single parent living with her daughter and mother in Brooklyn. Her current medications to control the hypertension are nifedipine, telmisartan, and furosemide, and she's currently well controlled on those medications. She was also switched from a combined oral contraceptive to a progestin-only pill. She is still sexually active. She does suffer from an expressive aphasia. Because of some confusion in her language, we're not entirely sure of her cognition. There are concerns about her ability to swallow, and some concerns with her sleep and reactive depression. We're concerned today about getting the opinion of all of you for this case. I think you've all had an opportunity to see the patient. We have colleagues who aren't currently present today who also need to be involved. And we need to start planning for discharge and to formulate a timeline. So, Kiyomi, why don't you tell us about your concerns for this patient and her speech?
So my primary concern definitely is the swallowing. So I had an opportunity to see the patient this morning and still having some challenges with swallowing. So currently on a mechanical soft diet with nectar thickened liquids. I know she doesn't really like that very much. So we're gonna work in terms of therapy to see if we can make some modifications. Definitely want to, tie in the dietitian and OT into that so that it could be a better experience for her. As far as language, with the expressive aphasia, definitely has presenting with anomia with some word finding issues. So we're gonna work on that in therapy as well. And it's mild, which is good in terms of the type of challenges she's having with language, but oftentimes she'll be trying to search for a word and just really struggling. Seems to be a point of frustration. So I don't know, what did you think?
Yeah, so I met with her earlier. She did mention that she wasn't really eating so well before she had this event. And her weight status is a little low, so I am definitely concerned about malnutrition with her. She definitely voiced that she really does not like the hospital diet, the altered consistency, so she's really eager to get into therapy and consistently work with you. From a nutritional standpoint, because we are so worried about malnutrition, I am thinking about liberalizing her diet and sort of going more the route of increasing potassium intake. That way she can have some of her favorite foods. And I know she mentioned that her mother is going to come a little later. So Kiyomi, if maybe we can do an education together and I can teach her about, some of her ethnic foods that would be great for potassium, and you can sort of help me with sort of getting it to a consistency that would be appropriate for her.
I think that would be great, and that really ties in the client's culture and takes that into account, because I know sometimes there are a lot of challenges when someone is sick, families want to bring in food. So I think patient education would be really great in having an opportunity to speak to the family so that she can have things that she really loves.
I'm glad you brought up the potassium as well, given the fact that the patient is on a loop diuretic.
Yeah.
And we have to be concerned about hypokalemia. Jennifer, what do you think about the patient's needs for occupational therapy?
So for occupational therapy, I had an opportunity to see her. I transferred her from supine to sit at the edge of the bed, and we did do a little bit of feeding and eating. So her right upper extremity is definitely weaker than the left, and that's her dominant hand. So we gotta start working on her using either the left hand to compensate during feeding activities, or, we have to do some remediation of that right hand to get it working better during eating. As far as her ADLs, her bathing and her dressing and toileting was all around moderate assistance. And I'm really looking forward to, incorporating her family, as you both said, into her eating sessions with us. And then maybe even going in together, to work on the whole eating situation.
And unfortunately, one of the things that she said is her favorite food to eat is the puddings that we get on the tray. And she's having some trouble with opening. So if that's one of the activities we can work on, and maybe have a nursing order for assistance in the evening with tray setup, that would be great.
So I have to tell you, I had a chance to work with her a little bit earlier. She's having a lot of pain on the right side of her body, which is not unusual. Post-stroke pain is really debilitating in some cases. And I noticed that just with certain movements on the right side, she reports that it's increasing her pain. And she's also having difficulty sleeping because of the pain. If she's not well rested, she's going to have more difficulty participating in therapy with you as well as with the physical therapist. So that's one of my goals, is to try to get that pain under control so that she can be more effective in doing the therapy that she needs to do.
Fantastic, thank you.
Maureen, what agents would you recommend for that?
Pardon, at this point, she definitely needs something to help with nerve pain, which is very common after a stroke. So there are different kinds of medications that we'll use. None of them will interfere with her hypertension management, but we'll be working with gabapentin medications like that.
And we'll work in therapy for deep breathing, trying to breathe through the pain when we're doing some exercises.
Right. Good, and that's something that I spoke with her about, using but complementary ways to be able to manage her pain. We talked a bit about using distraction as a way to be able to work through the pain without relying on medication if possible. She's very concerned about the long-term consequences, and she wants very much to get back to her previous life and her lifestyle, and she doesn't want pain or any of the associated problems that she's having right now to interfere. So we really need to work with some of the cognitive behavioral therapies. And we'll get social work involved when they're back with us.
Okay, and we'll work with physical therapy too, with her ambulation and transferring and such, so.
Ray, this patient faces enormous challenges, as does her family. A lot of this will fall on you and your department.
Yeah,
Have you seen her yet?
Yes, I went to introduce myself and to introduce the staff to her. And as far as pain is concerned, the nursing staff will certainly implement, the plan of care that Maureen will design. Another point of concern is returning home, how she will be managing. And as I see it now, nursing can partner with social work in order to devise a discharge plan. Some of the services she might need at home include, of course, the rehab services, PT, OT, etc. But as well as nursing, because nursing can go in and teach the mother especially how to manage the care. And there are several nursing agencies, so we'll present her with a list and see which ones are more appropriate for her. Insurance comes in. So any service that we provide will have to be covered. So this is where the social worker comes in. Also, we might need to do a home safety assessment, which can be done either by the home care agency sending a nurse to assess the home, or pictures. The mother can bring in pictures. And of course, she was concerned about her daughter. The mother will be taking care of the daughter as well as take care of her. So the mother's gonna need help. And one of the services that home care can offer is a home health aide to come in, assist with bathing and so forth. So we're working on that. So we'll work with the social service department to look into insurance as well as to formulate a discharge plan.
What services do you think this patient may require for her adjustment disorder? in terms of going from being a very high-functioning attorney, a single parent, to having, one hopes, a temporary disability, but a rather significant one.
I was really hoping that neuropsych would come on board this case, so.
Right, she had had a psych evaluation while she was still in the acute care setting, and they feel that there was no underlying mental health concerns, but as expected, she is having an adjustment disorder, so that we are going to need to continue to afford her the access to psychology while she's here in acute rehab, and that will be another thing that we'll need to look toward arranging, because it's certainly not going to go away in the course of a short stay. So we'll need to definitely have her get access to some kind of psych support in the community.
Home care can offer behavioral health. And in the community, the mother and the daughter, the entire family can benefit from that. So that would be one of the services we could offer.
That's great. Does anybody have anything else to add?
No, I just think we just have to continue to look at her progress, and I'm hoping she'll make more progress, especially with the swallowing. I mean, that's like, that's her quality of life.
And safety.
Yeah.
So I'll be covering you over the course of the weekend. Were there any kind of studies that you wanted done based on what you've seen so far?
I don't believe so, except probably a basic metabolic panel to check the electrolytes.
Yeah.
Okay.
I did notice on her last blood work, she was getting a little dehydrated, maybe because of the thickened liquids. And I know it's something that we talked about, maybe trialing her to be able to progress to liquids as one of our priorities, so,
Okay,
yeah.
no problem. So I'll put in for that. I'll put in orders for labs on the weekend.
What about our timeline?
I'm thinking around like 2 to 3 weeks, depending on progress. What do you?
Yeah, I think it's gonna depend totally on progress, but we're gonna do the trials of thin liquids and diet modification, so hopefully if that goes well, maybe, 3 weeks.
Yeah, sounds good.
Does that give you and Sharon enough time as well, do you think?
Yeah.
Okay. Good, sounds good.
Great.
Great, well, thank you all.
Thank
Thank
you.
you.
Thank you.